The following podcast is a discussion between two experts in their fields of beauty and not meant to be taken as medical advice. Be sure to consult with your doctor if you have any medical inquiries.
Okay, so we're doing a special mini podcast, and I'm pleased to be joined with Jonathon. Jonathon, how long have you been with me in our office?
I've been here 6 years now.
6 years?
Yes.
Seems like I guess if it seems like it's been forever, is that a compliment? Or is that...
It has.
Okay, so we're talking about lips today. And some of the most commonly asked questions in lips, we're just going to kind of run through them.
For sure.
You have a reputation as being one of, if not the best lip injector in the Midwest.
All right, well.
Okay, so let's talk about lips. So the biggest fallacy about lips is someone's coming in and they say, I don't want to look overly done. Mm-hmm. Is that the case with lip filler? Do you have to look overly done if you get lip filler?
Not at all. Everyone has a consultation and we talk about your goals basically. So depending on the look that you're going for, I'll pick the filler for you. But no, it doesn't have to be dramatic and overfilled, and I think that's what a lot of people get scared about. But everything is really conservative, and it's always better to underfill than to overfill, especially in the beginning.
Yeah, they point out to Lisa Renna, who is, I think she was beautiful. And then I think she just did a little something too much to her lips. Mm-hmm. I don't actually even think she has lip filler. I actually think she has lip implants, which is a whole nother topic and story. But a lot of the bad lip filler you see in celebrities, I believe it's either silicone or lip implants. But we're kind of just touching the tip of the iceberg.
Yeah.
Okay, so older versus younger patients. Do you find that your younger patients tend to be more conservative, or do they want to see a little something more? And then your older patients, again, are they going to push the envelope, or are they going to be more conservative?
You know what, surprisingly, I have a lot of young people wanting to be super conservative. They always say, I don't want to go too big. I don't want people to know. And that's where we talk about the specific filler for them. And one of the ones that I like to do is wrestle and kiss. Especially if you're wanting to be conservative, but have enough volume to show, a little bit of plump and juice.
So what's the difference between conservative and then kind of having your lips out there? Like, what are the things that you're looking for and patients are looking for when you're doing that?
Lip shape. So if someone is coming in and they have a very thin lip, I'm not going to go with, let's say, a voluma. I would rather start with a wrestle and kiss and build upon that, So we want to get the lip lifted and show a little bit more pillow, and then build on from that,
And I think lifting a lip isn't as easy as some patients think it is, because sometimes they'll say, I want my lips to look exactly like this person or that person. Mm-hmm. Can you make your lips look like anyone else's lips?
No, everyone is special. Everyone is different. And that's what makes you special, So definitely when we're injecting, I'm injecting specifically for you and what's going to fit your face and anatomy.
Can you, let's say if someone wants a dramatic result.
Yeah.
Can you get there from one session? So if someone comes in with very little lips and they say, I want my lips out there. I've always wanted, more lip. Can you do it in one session?
You know what? I always tell patients, if you're trying to go for a Kylie Jenner, it's definitely going to take some sessions. But in the first session, you're going to see a nice improvement. Even if you have thin lips, you are going to see a little bit of fullness. But it will take maybe 2 sessions to get there,
Cool. Mm-hmm. How long does lip filler last?
Depending on the product, it can last anywhere between 12 to 18 months. You also have to consider how fast your metabolism is and how much you're working out and all these things,
And then I know you can tell if someone has lip filler. Do you think other people, if they're kissing or doing something intimate with someone, like how I said that, do you think they can tell if someone has lip filler, or?
I don't think so. It really depends on the injector and the style of injection that they're doing. But I think if done right, you shouldn't feel any lumps or bumps in the lips. It should just be very soft and plush, natural.
Most common question is like, what is it going to feel like with my lips? And then early on, Is it normal to feel like little bumps in your lips?
I want to say in the beginning, you might feel a few lumps here and there, but they should totally dissolve and integrate with the tissues after like a week or two. And if they are still there, then that's when we can go a little further and see how we can fix that and correct that.
Cool. We're going to talk about some technical aspects of this. Do you think it's the filler that makes the difference in someone's lip shape, or do you think it's the injector? If you had to pick one, if someone says you can have anyone inject your lips, let's say you versus a, like a regular injector versus someone who specializes in, really has the experience behind them and does awesome lips, versus someone says, I'm going to use this product versus that product. What do you think is going to make the difference?
I really think it's the injector. Anyone can inject someone. That's easy, but it's an art form. You're sculpting someone's face, and I think it's important to tailor it to that specific person instead of just kind of going in and just doing whatever you think, So.
And speaking to that note, what are some of the issues you see with other injectors? So when patients come to see you and they've had an injection elsewhere, what's the main issues that you're seeing from those patients?
So from some of the patients that have talked to me, they've had complications with maybe the injector going in too aggressively, doing too big of boluses in certain areas, and then you have like these huge like nodules basically. And not watching how much they're filling. So you can get too much in one side versus the other, then you have all these asymmetries. Those are the few complaints that I've gotten.
I sometimes see that patients talk about migration from outside injectors.
Yes.
I think in my list, kind of speaking to the things that I know they see, one is migration. They feel like instead of putting it in the red of the lip, they put it in the white of the lip.
Correct.
And, the cartoon character they always describe when they say they put too much white lip, Homer Simpson. And I do not want to look like Homer Simpson.
Absolutely not.
And I think it's so much harder to fix plastic surgery than to do it right the first time.
100%. And that's a good point to bring up. I always tell patients, if you feel like you have migration, I think it's best to go ahead and dissolve the product and let's try to reshape from there, because it's always difficult to correct someone else's work.
Other things, asymmetry. Again, it looks simple in theory to inject lips, but it's so complicated. And almost everyone has a little bit of difference between one side versus the other. Correct. And you're trying to make them as perfect as possible. And it takes someone who's going to take time and not be under some sort of time crush and quotient. Let me just jam as much lip. And I think a lot of people don't even have the eye. Would you agree?
I agree. 100%.
Other things I note from outside injectors, aside from asymmetry, aside from filler migration, sometimes it feels like they don't create enough change. I think we've seen some patients who said they've had outside injections and said, I put it in, it didn't look maybe okay the day of, and then 2 weeks later, it was all gone.
Correct.
Do you see that?
I do definitely see that a lot. And I always ask, do you remember what product they use? And what's funny is that some of these patients don't even know what product they use. They can't remember, or they weren't even told. They kind of just go in blindly and hope for the best. And I always think it's super important to discuss which product you're using and to see what's going to basically fit with that patient.
And I do think there is some technique. I think there is some difference in product, but I actually do think there's some technique when you're injecting. If you put it in the wrong part of the lip, it might not last as long. And especially if you put it in the muscle area, or if you're putting it too deep, again, you're going to cause more migration and you might not create the lip change that you want to. So, if you're not seeing it that day, you're probably less likely to see it down the line.
Correct.
And that aspect of it. And again, wow. Okay, so that's another issue that we see with lips. And I think the other issues are just kind of there's so many intricacies of lips. If you really look at lips and lips of those around you and lips of people you love, you're going to see that maybe the middle part of the lip, called the tubercle, might be a little bit more pronounced, so you have to balance it. You might see the cupid area someone might need a little bit more definition versus all these little areas. And so when you're balancing those areas out, it's not easy, right?
It isn't easy at all. Everyone wants, specifics on their lips. I want the top lip being bigger. I want the bottom lip being bigger. I want it this way or that way. And you have to remind them. It's not always what you think, we have to tailor it specifically to your anatomy,
So do you have a one-size-fits-all? Do you use the same technique with everyone? Say, I'm going to use this or that? Or is it sort of like...
It's different, really. It's really just depending on the lip shape. I use different modalities, and sometimes I mix and intertwine with them, and it always turns out really good.
Cool. Well, beautiful, beautiful results with lip filler with Jonathon, and I think it's always good to kind of see that. And so, if you're going to do something with your face, I think it's worthwhile doing it right and doing it with someone you believe in their work. So, thank you so much for an expert at lips and injectables, Jonathon. Thanks so much.
Yeah, thank you for having me, doctor.
Cool.